In this video, we are going to look at 15 points why and for which health conditions you should avoid eating eggs. Eggs, despite their many health benefits, may not be safe for some people. This nutritious food, rich in protein and vitamins, can cause health problems for those who suffer from certain health conditions. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like and let's get started. Number 1. High cholesterol. High blood cholesterol is one of the significant risk factors for developing cardiovascular disease. Cholesterol is a fat-like substance that is found in some foods and is also produced in the body. It is essential for normal cellular function, but an excess of it can be harmful. Eggs are one of the foods rich in cholesterol. One average egg contains approximately 186 milligrams of cholesterol, which is more than half of the recommended daily allowance for people with high cholesterol. Consuming large amounts of cholesterol from food can cause it to build up in the blood, especially if there is a genetic predisposition or other risk factors. When blood cholesterol levels become too high, fatty deposits known as plaques can form on the walls of the arteries. These plaques can narrow arteries and restrict blood flow, increasing the risk of heart attack or stroke. Research shows that while cholesterol from food doesn't always directly raise blood cholesterol levels in all people, it can have a significant impact in some people. People who already have problems with high cholesterol should be especially cautious of foods high in this substance. For those who suffer from high cholesterol levels, it is recommended that they limit their egg intake or consume only egg whites that are cholesterol-free. This helps to lower the total cholesterol levels in the diet, which can be a helpful step in managing blood cholesterol levels. It is also important to balance your diet by including more cholesterol-lowering foods. These foods include oats, nuts, legumes, fish, rich in omega-3 fatty acids, and vegetables. Regular physical activity and maintaining a healthy weight also play a key role in managing cholesterol levels. Thus, eggs, despite their nutritional value, can exacerbate problems with high blood cholesterol levels. People with this condition are advised to closely monitor their diet and, if necessary, consult a doctor or dietitian to develop an optimal eating plan. Number 2. Cardiovascular diseases. Cardiovascular disease, CVD, is one of the leading causes of death in the world. It is important for people with CVD to control their diet, especially their intake of cholesterol and saturated fat. Eggs contain significant amounts of cholesterol, about 186 milligrams in one average egg, and saturated fat, which can aggravate the condition. Cholesterol and saturated fat contribute to the buildup of fatty deposits on the walls of arteries, causing them to narrow and restrict blood flow. This condition is called atherosclerosis and is a major cause of cardiovascular disease. Narrowing of the arteries increases the risk of heart attack or stroke. It is recommended that you limit your egg intake or consume only egg whites, which are free of cholesterol and saturated fat. Instead, include more vegetables, fruits, whole grains, nuts, and fish rich in omega-3 fatty acids in your diet. Regular physical activity also plays an important role in maintaining a healthy heart. Thus, people with cardiovascular disease should limit their intake of cholesterol and saturated fats found in eggs and focus on a balanced diet rich in heart-healthy foods. Consulting with a doctor or nutritionist can help you develop an optimal eating plan. Number 3. Pancreatitis. Pancreatitis is inflammation of the pancreas, an organ that plays a key role in digestion and blood sugar regulation. When the pancreas is inflamed, it is important to watch your diet and avoid foods that can aggravate the condition. One such food can be eggs. Eggs are a rich source of protein and many nutrients, but they also contain fat and cholesterol, which can increase the burden on the pancreas. In pancreatitis, this is especially important because an inflamed pancreas cannot perform its functions effectively. Egg yolks contain more fat than whites and may be harder to digest for people with pancreatitis. These fats can stimulate the pancreas to produce more enzymes, which can increase inflammation and cause pain. Therefore, if you have pancreatitis, doctors usually recommend limiting your egg intake, especially the yolks. However, egg whites, on the contrary, are an excellent source of easily digestible protein and contain minimal fat. They can be included in the diet for pancreatitis, but as with any dietary changes, it is important to consult your doctor. Instead of whole eggs, you can prepare protein-only dishes such as omelets or casseroles. This will allow you to get the protein you need without putting unnecessary strain on your pancreas. It is also useful to steam or boil eggs to reduce the amount of fat. Thus, with pancreatitis, it is important to carefully consider the choice of products. Egg whites can be a healthy part of the diet, while yolks should be limited. Consultation with your doctor can help you develop an optimal diet plan that will keep you healthy and prevent exacerbations of the disease. Number 4. Gallstone disease. Gallstone disease is a condition in which hard particles called stones form in the gallbladder. These stones can cause pain and other unpleasant symptoms, especially when they block the bile ducts. One of the key aspects of managing this condition is proper nutrition. Eggs are a food that can affect people with gallstone disease. They are able to stimulate the production of bile in the liver. Bile is a fluid that helps the body digest fats. Under normal circumstances, this is a beneficial process, but for people with gallstones, increased bile production can cause problems. When you consume eggs, especially the yolks, your body starts producing more bile to digest the fats in them. This can lead to increased pressure on the gallbladder and bile ducts. In people with gallstone disease, this can cause stones to move, leading to pain and possible blockages in the bile ducts. Because of this, many doctors recommend that people with gallstone disease limit their consumption of eggs, especially the yolks. Instead, you can only use egg whites, which are lower in fat and do not stimulate bile production as much. However, it's important to remember that reactions to eggs can be individualized. Some people with gallstone disease are able to safely include eggs in their diet in moderate amounts. It is always a good idea to consult with your doctor or nutritionist to determine which foods are best for your condition. Number 5. Diabetes. Type 2. Diabetes is a chronic condition in which blood sugar levels become too high due to an impairment in the body's ability to utilize insulin. Some studies show that regular egg consumption may be associated with an increased risk of developing type 2 diabetes. This is due to the high cholesterol content of eggs, which can impair the cell's sensitivity to insulin. The cholesterol and saturated fat found in eggs can contribute to insulin resistance, a condition in which cells are less responsive to insulin, which is one of the main causes of type 2 diabetes. If you have diabetes or are at risk, it is recommended that you limit your egg intake or consume eggs in moderation. Instead, it is better to opt for other sources of protein such as fish, skinless chicken, legumes, and nuts. Consulting with a doctor or nutritionist can help determine the best way to incorporate eggs into your diet to minimize risks and maintain healthy blood sugar levels. A balanced diet and regular physical activity remain key elements in managing diabetes and maintaining overall health. Number 6. Hyperlipidemia. Hyperlipidemia is a condition in which the levels of lipids such as cholesterol and triglycerides in the blood are elevated. Eggs contain a significant amount of cholesterol, about 186 milligrams in one average egg. For people with hyperlipidemia, eating eggs can worsen the condition, as extra cholesterol from food can raise total blood cholesterol levels. Elevated blood cholesterol levels can cause fatty deposits to form on the walls of arteries, which narrows their lumen and restricts blood flow. This increases the risk of heart disease and stroke. To avoid worsening the condition, people with hyperlipidemia are advised to limit their egg intake or consume only egg whites, which are cholesterol-free. Other sources of protein, such as fish, skinless chicken, legumes, and nuts, can be used instead of eggs. Consulting with a doctor or nutritionist can help determine the best diet plan to maintain healthy blood lipid levels. A balanced diet and regular physical activity play a key role in managing hyperlipidemia and maintaining a healthy heart. Number 7. Atherosclerosis. Atherosclerosis is a disease in which fatty deposits form on the walls of arteries, narrowing them and restricting blood flow. A diet low in cholesterol and saturated fat is recommended for people with atherosclerosis. Eggs contain significant amounts of cholesterol and saturated fat. One average egg has about 186 milligrams of cholesterol and 1.6 g of saturated fat. Egg consumption can raise blood cholesterol levels and aggravate the condition. People with atherosclerosis are advised to limit their egg intake or consume only egg whites, which are free of cholesterol and saturated fat. Instead of eggs, fish, skinless chicken, legumes, and nuts can be included in the diet. A balanced diet rich in vegetables, fruits, whole grain products, and healthy fats such as omega-3 fatty acids will help lower cholesterol and improve arterial health. Regular physical activity is also important for managing atherosclerosis and keeping your heart healthy. Consulting with a doctor or nutritionist can help you develop the best nutrition plan to minimize risks and maintain cardiovascular health. Number 8. Irritable bowel syndrome, IBS. Irritable bowel syndrome, IBS, is a chronic condition that presents with abdominal pain, bloating, diarrhea, and constipation. Diet plays an important role in managing IBS symptoms, and certain foods can cause exacerbation of symptoms in people with this condition. Eggs, despite their nutritional value, can cause exacerbation of IBS symptoms in some people. Egg consumption can lead to bloating, gas, and abdominal pain, especially if a person has a sensitivity to certain proteins found in eggs. Some people with IBS may have trouble digesting the fats in eggs, which can also cause discomfort. The yolks of eggs are rich in fats, which can stimulate the intestines and cause symptoms to worsen. If you have IBS and notice that eggs are causing your condition to worsen, it's worth trying to eliminate them from your diet or limit their intake. Instead, you can use alternative protein sources such as fish, skinless chicken, legumes, and plant-based protein products. It is important to keep a food diary to keep track of which foods are causing your symptoms to worsen and discuss your observations with your doctor or dietitian. They can help you develop a personalized eating plan that will help minimize IBS symptoms and improve your quality of life. Number 9. Celiac disease. Celiac disease is a condition in which the body reacts negatively to gluten. Eggs themselves are gluten-free and are safe for people with celiac disease. However, some products with eggs can be cross-contaminated with gluten during preparation or packaging. To avoid cross-contamination, choose foods labeled gluten-free and check to see if they were produced in facilities that do not use gluten-containing ingredients. When cooking at home, use separate cooking utensils and equipment for gluten-free foods. So while eggs are safe on their own, it's important to be careful with foods containing eggs to avoid cross-contamination with gluten. Number 10. Gout. Gout is a form of arthritis that occurs due to high levels of uric acid in the blood. Uric acid forms crystals that deposit in the joints and cause pain and inflammation. One factor that affects uric acid levels is diet. Eggs themselves do not contain purines, substances that are converted into uric acid in the body. Therefore, eggs do not directly increase uric acid levels. However, in some cases, a high intake of protein, including eggs, may indirectly contribute to elevated uric acid levels. People with gout are advised to watch their diet and avoid foods high in purines, such as red meat, seafood, and certain types of fish. Eggs can be part of a gout diet, but they should be consumed in moderation and as part of a balanced diet. So eggs are not a major source of uric acid, but eating them in moderation and paying attention to the overall protein levels in your diet will help manage your gout symptoms. Number 11. Liver disease. The liver is an important organ responsible for many functions including detoxification, metabolism, and protein production. If you have liver disease such as cirrhosis, hepatitis, or fatty liver disease, it is important to follow a diet that does not burden this organ. Eggs contain significant amounts of protein and fats, which can increase the burden on the liver, especially if its function is already impaired. Protein and fat require extra work to process and metabolize, which can be problematic for a damaged liver. If you have liver disease, it is recommended that you limit your egg intake or consume eggs in moderation. Instead, you should focus on foods that are easy to digest and do not require extensive liver work. These can include vegetables, fruits, whole grain products, and lean sources of protein such as skinless chicken and fish. Thus, for people with liver disease, it is important to limit egg consumption to reduce stress on the organ and support its function. Consultation with a doctor or dietitian can help develop an optimal diet plan. Number 12. Endometriosis. Endometriosis is a condition in which endometrium-like tissue grows outside the uterus, causing pain, inflammation, and other symptoms. Some studies suggest that consuming foods high in cholesterol, such as eggs, may worsen endometriosis symptoms. The cholesterol and saturated fats found in eggs can promote inflammation in the body, which is particularly undesirable in endometriosis. Inflammation can increase pain and other symptoms of the disease. If you have endometriosis, it may be a good idea to limit your consumption of eggs and other foods rich in cholesterol and saturated fats. Instead, it is recommended that you choose foods that help reduce inflammation, such as vegetables, fruits, whole grains, and fish rich in omega-3 fatty acids. Consulting with a doctor or dietitian can help determine the best diet to manage endometriosis symptoms and improve your overall health. Number 13. Polycystic ovarian disease. Polycystic ovarian syndrome is an endocrine disorder characterized by an imbalance of hormones. Women with PCOS often have elevated levels of androgens, male hormones, and problems with cholesterol levels. Eggs, especially the yolks, contain significant amounts of cholesterol. Egg consumption can contribute to elevated blood cholesterol levels. This can worsen symptoms of polycystic ovarian syndrome, such as menstrual irregularities, excessive hair growth, and acne. In addition, a high intake of cholesterol and fats can contribute to increased androgen levels, which can also worsen symptoms. Therefore, women with this condition are advised to limit their consumption of eggs, especially yolks, and focus on a diet rich in vegetables, fruits, whole grains, and lean sources of protein. A consultation with a doctor or dietitian can help determine how to incorporate eggs into the diet to minimize risks and manage symptoms. Number 14. Acne and skin diseases. Acne and other skin conditions can be aggravated in some people when eggs are consumed. Eggs contain many proteins and fats that can cause inflammatory reactions in the body. In some people, these reactions show up on the skin in the form of acne, redness, and other rashes. This can be caused by a personal intolerance or allergy to eggs, especially the protein in them. Egg protein can stimulate the immune system, causing inflammation that shows up on the skin. If you notice your skin condition worsening after eating eggs, it is worth considering eliminating them from your diet. It is important to keep a food diary to track your skin's reaction to different foods. This will help to identify if eggs are indeed a trigger for your skin problems. Consulting with a dermatologist or nutritionist can help you develop a diet plan that will improve your skin and prevent aggravations. Sometimes just limiting the amount of eggs in your diet or switching to alternative protein sources is enough. Number 15. Digestive disorders. In some people, eggs can cause digestive problems. These problems can manifest as bloating, abdominal pain, and sometimes diarrhea. The causes can range from intolerance to the proteins found in eggs to individual sensitivity to the fatty components present in the yolks. If you notice that after eating eggs you have discomfort or digestive problems, it is worth paying attention to the amount of eggs eaten and the way they are prepared. It may be better to limit their consumption or prepare eggs in a way that makes them easier to digest, such as boiling or steaming. Consulting with a doctor or dietitian can help you determine if eggs are the cause of your digestive problems and how you can adapt your diet to improve your health. What do you think about this? Do you agree with these statements? If there are any questions, ask them in the comments. More information on this topic can be found at the links in the description below this video and on our channel.
Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.